Raywat, what's your reaction to these new measures?
Well, all new measures are good. I don't think they go far enough, frankly. I saw the press relief, and the statement was there was a race between variants and vaccines. I don't think that's right. I think that race has been won by the variants. The race is between the race between the vaccines and ICU capacity now. So with that in mind, it strikes me the responsible thing to do is to close all unnecessary indoor opportunities. That means places of worship. That means bars and restaurants. It means schools. It means gyms. So this thing spreads inside. So take out the indoors and move everything outdoors.
So what's your expectation of what's going to happen here in Manitoba in the days and weeks ahead without those measures in place?
Ooh, tough to say. I mean, it's balanced against the rate at which you can vaccinate. So if you're vaccinating, at scale rapidly, then it might work, right? If not, then I think any decline that is observed will be slow. And anytime you can accelerate that decline, you should attempt to do so. So that means taking away all indoor opportunities. The other part of this is that we're pretty sure now that COVID is airborne, which means that if you're indoors, you got to make sure the proper ventilation requirements are observed as well. Better quality masks and better cross breezes and so forth.
And today, Dr. Roussen's saying that it appears that the bulk of the transmission is happening in private residences. Would you agree with that assessment?
Yeah, that makes sense to me, which means that people have to stop going to other people's homes. But even if the bulk is in those scenarios, it doesn't mean we shouldn't target the minority transmission as well, especially given the new variants. All it takes is a handful of cases of the new variants to explode into large outbreaks. So we have to monitor all opportunities for transmission, not just the biggest bang for your buck ones.
So if I'm speaking to new Premier of Manitoba, Raywat Deonandan, you're closing schools, you're closing restaurants, potentially even having stores go to pick up or delivery options. Would you allow any outdoor gatherings?
I would allow all outdoor gatherings, frankly, so long as appropriate public health gatherings rules are observed. That means distancing and mask wearing if you are close to each other and spending a lot of time together. I think we should incentivize and encourage outdoor activities, just make them safer. So this is an endeavor in harm reduction. We don't want people to feel trapped in their houses. We want them to be able to have the activities they're used to, but in a safer way.
Rich?
With Raywat Deonandan, Richard and Julie on 680 CJOB, is there a part of the country then that has it right?
Well, for the longest time, we thought Atlantic Canada had it right, and they still do for the most part, but they're struggling a little bit now as well because these variants really are extraordinary. It looks like some parts of Atlantic Canada are also using rapid testing now. So they seem to be more on board with trying new things and trying things that have been shown to work in other countries, like COVID-0 and rapid testing and things like that. So the overall response, I give it to them. The territories are doing fairly well as well, but they have the advantage of small populations. Provinces are touch and go. And I'm sympathetic because we're dealing with enormous economies, enormous numbers of people, competing agendas. Not everyone can manage this the way that New Zealand and Taiwan have, for example. But to the extent that anyone can, I'm impressed by the Atlantic provinces.
That's why you're not premier, but I look at those ICU numbers. Right now, 37 in intensive care, 148 people in hospital. That hospitalization is going up. The ICU is likely to go up as well in the days ahead if Alberta, BC, and Ontario are any examples. And the examples that they've set, well, ICU capacity is still over capacity in Toronto. They're shipping patients to other parts of the province.
Yeah, it's true. Mind you, our case numbers seem to be plateauing, but it'll take a while before the ICU growth follows that because that's a lagging indicator. So we're still going to have some crisis days and weeks ahead. It looks like, though, the steps that we took seem to be paying dividends in terms of actually incidence of cases. So hopefully that is the trajectory that Manitoba takes as well. You'll see your cases go down first, and then after that, the ICU usage. But it's still possible, if not probable, that you'll exceed capacity somewhere in that endeavor. So that's why I'm advocating go hard, go quick, right? So take away all opportunities for transmission. It doesn't have to be for an extended period of time, just a short period of time. And the harder and earlier you go, the shorter the duration of that exercise.
All right. Well, we've made you the premier of the province. If you were the prime minister of Canada today, his opposition leaders are saying that, despite the fact that we're not all vaccinated in this country, they want vaccination help sent to India. Does that need to be done for us ultimately to get out of this situation as we look at what the tragedy that is unfolding there?
Ultimately, yes. You've heard the old adage, no one is safe until everybody is safe. And that is true because we are a self-contained planet where people intermingle somewhat unrestrictedly. So long as this disease is percolating somewhere in the world to some great extent, new variants will emerge which would threaten the entire species. It's in everyone's best interest to quash it where it is most transmitting. That means focusing on India and Brazil and places like that with the resources we have. That doesn't mean we have to curtail and limit the Canadian opportunities for vaccination. It just means we have to have an eye on those other places around the world and do not let geopolitics and the tragedies of economics curtail our abilities to help others.
It certainly is a difficult position that we've put you in, asking you to be our premier and our prime minister, but you're the one that's objectively looking at the numbers. So what do you say to people today who are really sad? As I look in, even within my own household, I have a son with a girlfriend, and they're saying, oh, we're going to have to, not spend time together for another month after they've done it for 3 months in the late fall and early winter. To people that
Ooh,
she got bumped off her computer, but you know the essence of the question.
Sure, absolutely. I say we are near the end. This will be done for the most part in Canada sometime this year. I think sooner rather than later, especially if we do all the right things. So people are tired of hearing this, but it's always hardest near the end. It's always darkest before the dawn, even though that's not true in terms of astrophysics, but you know the old adage. So we can see the finish line. You just have to tighten your belt and just persevere a little bit longer, and then we never have to do this ever again. That's my message. We are near the end. So focus on that.
Raywat, appreciate the time. Thanks so very much for joining us.
Thank you.